Do you wish you could turn back the clock on aging? Anti-Factor Lipids is the breakthrough supplement that's scientifically proven to repair and renew your body's cells. Anti-Factor Lipids are identical to the phospholipids found in your cellular membranes. They've been shown to repair mitochondrial damage, a primary cause of biological aging. Anti-Factor has also been shown to reduce fatigue by more than 40%. And it's even been shown to significantly reduce a wide range of symptoms and improve the quality of life in patients with various conditions like chronic fatigue and those undergoing chemotherapy. I've been using Anti-Factor for years. I don't go a day without it. Anti-Factor Lipids comes in an easy-to-use powder in 2 convenient sizes. For more information and to order, just call 800-982-9158, 800-982-9158, or go to ntfactor.com. That's ntfactor.com for Anti-Factor Lipids powder. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Our guest is Dr. Bret Scher. He's medical director of the Coalition for Metabolic Health, and we're talking about all the ways that we can support our metabolic health. We talked in part 1 about what constitutes metabolic health and some of the medical conditions that lack of metabolic health leads to. In part 2, I'd like to talk about the application of low-carb diets, which seems to be the direction that Coalition for Metabolic Health favors in addressing some of the major health challenges that afflict Americans. So, one of the things that I think is really very, very disconcerting to the public, Dr. Scher, is seeing all these studies, contradictory studies that say that meat is bad for you. Meat causes cancer. Meat causes cardiovascular disease. But then other studies that exonerate meat. Same thing with dairy products. We've seen that with coffee. Coffee is bad for you. Now coffee is considered a health food. Yeah. And you know, on and on it goes. So help us to sort out why is it that nutrition research is in such a pickle?
Yeah, that's a great point, Dr. Hoffman. I'm glad you brought that up because it really is that nutrition science tends to be low quality science. And again, that's not a judgment. That's just by definition. So these nutrition epidemiology studies, they will follow, tens or hundreds of thousands of people over their lifetime, and they will measure, blood tests and ask what they're eating maybe twice over a 15-year period. And then from that, they're going to try to make a determination of whether red meat is good or bad for you, right? And what you find is the people who eat red meat or don't eat red meat have drastically different health habits and health status. And it's not because of the red meat. That's just the way they are. They are very different individuals. And it makes sense because if you're hearing from your doctor, eat less red meat. If you're hearing, from your dietitian and billboards, eat less red meat, and you're still eating red meat, you're going to be a different type of person.
Maybe you're just a less conscientious kind of person. And
possible,
maybe you also are you're driving 75 in a 60 mile an hour zone, and maybe you're puffing on a cigarette here and there when you can bum one, right, and so on.
Well, so that's the perfect example because these studies show all you have to do, they lay out these tables of the baseline characteristics. The meat eaters smoke more, drink more alcohol, exercise less, eat more calories total, and eat the same amount of carbohydrates and more sugar. So is it any surprise that they're going to have more diabetes,
just eat more
heart disease?
They're less discriminating about their food in general.
Exactly.
Yeah.
Right. And does this mean every meat eater is that way? No. But on average, in these studies, that's what we see. So then when we see a very small difference, so the outcomes tend to be what's called hazard ratio or odds ratio. So an outcome difference of like 1.4, which means you could say you're 40% more likely to have a condition. On the one hand, that sounds scary.
Yeah.
But to put it into context, smoking and cancer had a hazard ratio of 20, which means like you're 2,000 times more likely.
Okay.
Right? Like that's a strong association. This 1.4 is incredibly weak association. Mm-hmm. And then you talk about those healthy user habits that from the baseline characteristic, and it means nothing. So that's why you're going to find one study that shows it's bad for you, one study that shows it's good for you, and then whether it's the randomized controlled trials that have been done, which is a more controlled trial, says half you eat more saturated fat or red meat, half you eat less. There tends to be, again, little to no difference at all. Now, those are shorter. They may be 5 years, whereas the observational ones can be 10 or 20 years, et cetera. So there is no really good nutrition study to answer the question. And that's part of the problem. And we like to hang on to the studies that back our beliefs. And that's why you'll see the vegan doctors saying, see, red meat's terrible. And you can see, to be fair, some of the keto, low carb, carnivore doctors saying, see, red meat is perfectly fine for you, and picking their study. But the truth is that the evidence is low quality evidence. But it is very clear that there is strong evidence that people eating diets with meat, with red meat, who are eating low carb whole foods diet, improve their health almost across the board. So it is clear you can improve your health eating meat. That does not mean you have to eat meat. It does not mean low carb is the one way everybody should eat. But it is clear that you can definitely improve your health, your metabolic health, by eating low carb, including meat. Not that it has to have meat.
So let's distinguish between low carb diets and ketogenic diets. Keto is popular these days. There's a difference, right?
Yeah, absolutely. So pretty much all keto diets are low carb, but not all low carb diets are keto. So a ketogenic diet is any diet that reduces the carbohydrates enough so that your body switches from burning primarily glucose for fuel to burning primarily fat and ketones for fuel. So it's a metabolic switch, and it is a perfectly natural physiologic state that we would not have existed through evolution if we didn't have.
It happens when we fast. When we fast.
Right.
Yeah.
Exactly. So for most people, that would probably mean less than 30 grams of carbohydrates per day, but it can vary. People can eat 50, 75, even 100 grams of carbohydrates per day and still get into ketosis. And this is where it's very different about, how do you sleep? How do you exercise? What is your metabolic health? All those things come into it. And a low carb diet, sort of by definition, is less than 130 grams of carbohydrates per day, which is, there's a wide range in there. And again, how people respond is going to be a little bit different, but those are the differences. And the main point of a ketogenic diet is it puts you into the state of nutritional ketosis.
Now, you mentioned something, we kind of glossed over very quickly in part one about the impact of metabolic health on brain function. I think it's pretty obvious that poor metabolic health, obesity and high blood sugar and high blood pressure, that can lead to heart attacks. We can even make the argument that certain cancers occur more often in people who are obese. I think that's been pretty clear. But when it comes to brain health, I think this is kind of like the new frontier of metabolic research.
Yeah, so I'm fortunate enough to be the medical director at the Coalition for Metabolic Health and the medical director of Metabolic Mind.
Great.
And at Metabolic Mind, we're a nonprofit that focuses on this connection between metabolic and mental health, and using metabolic therapies like ketogenic therapies to actually treat psychiatric conditions and mental illnesses. And there is emerging research and just growing clinical experience of using ketogenic therapy to treat severe depression, to treat bipolar disorder, schizophrenia, even OCD or anxiety, and now even anorexia. So it really is this explosion of this field of metabolic psychiatry, which has grown dramatically. And it in a way, it makes sense. You talked earlier about how you spoke with Dr. Martin Picard, who studies the mitochondria. And that's really kind of what it comes down to, because it's in the mitochondria where we can transform food and oxygen into energy. And there are studies showing a decreased energy output in many psychiatric conditions, specifically the decreased ability to use glucose for energy, but the ability to use ketones persists in that state. So you can sort of bypass the hampered ability to use glucose by providing ketones. And doing so with a ketogenic diet is going to improve your metabolic health and feed ketones to your brain, which is showing an improvement in many psychiatric symptoms.
Yeah, I recently saw an article, and this is not new because this has been talked about. And in fact, there's a book entitled Brain Energy by, I believe it is Casey and Callie Means, real popular bestseller.
Brain Energy is Dr. Chris Palmer.
I'm sorry, Chris Palmer, who has been a guest on the program. He, I think, is a pioneer in exploring this. And he's a board-certified psychiatrist is really harnessing this paradigm to help patients with psychiatric disorders. But recently there was, mainstream discussion of this with a new study that depression is actually a tired brain, a brain where the mitochondria aren't working efficiently. And if we could just target the mitochondria, rather than using psychoactive drugs to boost serotonin or whatever, dopamine, et cetera, that we would actually make inroads against depression.
Yeah, and there's a lot of clinical experience and emerging evidence to that point. There's a recent publication called the KIND trial from Dr. Jeff Volek and his lab at Ohio State University. And this was a pilot trial, but they in college college subjects, they instituted a ketogenic diet, and they all had major depressive disorder. And everybody who completed the trial showed significant improvements in their depression symptoms, with the only intervention being the ketogenic diet. So it does certainly seem that there is a signal there. Now, as with any emerging scientific field, you're going to start with pilot studies and move on to larger randomized controlled trials. But in the meantime, what do? Right? Or do you just wait for the randomized controlled trials, or do you want to help people now? And since we're not talking about a drug that needs FDA approval with severe side effects, we're talking about a way of eating, a natural physiologic state. It really makes a lot of sense that it's something people could consider with their healthcare team. Now, one of the things that's really interesting about ketosis as a medical intervention is it's as powerful as other medical interventions, which may mean you need to change medications or stop medications, or need to be aware of some side effects like what we call the keto flu. So that's why at Metabolic Mind, we are very serious about people working with their healthcare team when instituting ketogenic therapy to treat a medical condition.
It's a serious intervention. It's like it's a powerful samurai sword, but has to be wielded very carefully and selectively. Also with potential impact for neurodegenerative diseases, right? Alzheimer's with potential for Parkinson's, I understand.
Yeah, a simple statement is the brain likes ketones, and it doesn't sound very scientific, but it actually is pretty reflective, because this started as a treatment for epilepsy. Specifically pediatric epilepsy, and still is used for drug-resistant epilepsy. Well, it also can be used, as I mentioned, depression, schizophrenia, bipolar disorder, and in early cognitive decline. Dr. Stephen Cunane and Dr. Matthew Phillips have published studies using various versions of a ketogenic diet or ketone supplements to treat cognitive decline, and are seeing some very good early results. And like you said, some early patterns in Parkinson's. People are talking about it for multiple sclerosis or even ALS. And of course, these are all very early and emerging, but there is some hope there that is going to be fairly beneficial.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Have you ever heard someone say that probiotics didn't work for them? Since all probiotics are not the same, the probiotic you choose can make the difference between superior results and no results. Look for an enriched formula containing these 3 key components for best results: probiotics, prebiotics, and postbiotics. A worldwide leader in microbiome health for over 40 years, Dr. Ohhira's Probiotics is an enriched full-spectrum probiotic system fermenting multiple strains of probiotic bacteria and nourishing prebiotics. The result? Transformative postbiotic metabolites that maintain and support the biodiversity of flora in your gut for optimal digestion, gut-brain, and immune health. Dr. Ohhira's, certified vegetarian, free of gluten, allergens, dairy, and GMOs. For a superior probiotic formula, get Dr. Ohhira's probiotics today at Sprouts, Natural Grocers, and other natural health retailers nationwide.
Thanks for listening, and thanks for supporting our sponsors because they are what make Intelligent Medicine a continuing free resource to you. And now back to today's guest, Dr. Bret Scher, the medical director of the Coalition for Metabolic Health. Well, as you know, the elephant in the room on the health front is the advent of these marvelous GLP-1 drugs that cause people to lose double digits of their body weight percentage. And is that a solution for the problem of rising metabolic unhealth? Or is it just kind of a partial fix?
Yeah, I would argue it's an aid, but not a solution. And at the Coalition for Metabolic Health, we convened a GLP-1 task force and wrote a position paper on GLP-1s. So I encourage people to go to our website, coalitionformetabolichealth.org, to check that out. But basically, if you're trying to treat a disease with a medication that you will now be dependent on for essentially the rest of your life, that's kind of a recipe for failure, especially a medication that, has different levels of expense.
Yeah, it's not like an antibiotic. I understand that antibiotic research is really in trouble because if they come up with a very successful antibiotic, you'll take it for a week or two and that's it. But these drugs are lifetime prescriptions, so they're highly underwritten by the pharmaceutical industry. And it'd be one thing if they cured the problem of weight gain and they left you at a nice lower weight plateau and was sustainable, but unfortunately there's such a rebound problem.
Right. So the efficacy data is remarkable. The amount of weight you can lose from these drugs is the best we've ever seen from a weight loss drug. But the real world experience is something very different. There are studies showing only, less than 50%. One study showing less than a third stay on the medication at 1 year. So what good have we really done? Another study showing when you come off the medication, you gain back 100%, if not more, of the weight. So what good have we done? So
Four times faster, it turns out, than if you had lost the weight the old-fashioned way.
Yeah, right. So by all means, though, I think we should be using these medications as a tool, but using it in conjunction with effective lifestyle interventions. And there was actually a publication from the team at Virta Health demonstrating that a ketogenic diet was effective at taking people off GLP-1s and maintaining the weight loss. And also ketogenic diets have shown improved body composition, whereas GLP-1s tend to show significant skeletal muscle, lean muscle loss, up to 40%. So I think a ketogenic intervention plus GLP-1s is a very effective intervention, with the GLP-1s as a Kickstarter, as an aid to then help wean it off and then have people maintain the lifestyle. That doesn't mean ketogenic diets are the only diets people should use if they're on GLP-1s. I just happen to think they're going to be one of the most effective, but not everybody's going to want to do that or tolerate that. But some sort of intensive lifestyle intervention needs to be combined with the GLP-1s with a future hope as an off-ramp of the drug.
And the advantage of that in the context of taking a GLP-1 drug, which reduces your appetite and reduces your food consumption, is that on a keto diet or a low-carb diet, you'll be prioritizing protein. And that is especially important when you're losing weight rapidly to sustain lean body mass, which often you get an acceleration of the process of sarcopenia, which is loss of muscle mass.
Yeah, I remember hearing this podcast a while ago where they were talking about this 40% lean muscle loss with GLP-1s. And they said, yeah, but that's kind of what you see with weight loss surgery and severe caloric deficit. So it's okay. That is not okay. I mean, that just shows how those other ways of weight loss are effective on the scale, but potentially very dangerous for long-term sarcopenia, frailty, weakness, poor body composition. And it would be much, much better if we can have that weight loss while maintaining lean muscle mass. And that's where either a higher protein or a lower carbohydrate, moderate protein diet has shown to be very effective. Of course, combined with resistance training, even better. But with GLP-1s, you tend to lose your taste for quote unquote heavier foods,
Yeah,
which protein
indeed.
can sometimes
Yeah.
be thought of, and you reach for the comfort foods because you've
Hmm.
got this little low level nausea for a lot of people,
Yeah.
and that's a dangerous combination.
Yeah. People eat. I mean, I've dined with people who are on these drugs, and they kind of push the food around a little bit. And,
Hmm.
I say, I hope we're going to get a doggy bag because, you just paid $45 for that steak, you know? So, yeah.
They have very
Uh,
happy dogs at home if they're giving their leftovers to their
for
dogs.
sure. Or it could be breakfast the next morning. So let's talk a little bit about the kids, because I think a really important focus of MAHA, or the Coalition for Metabolic Health, is to address childhood nutrition. So
Yeah.
what does the coalition want to do when it comes to kids and schools and
Yeah.
getting kids to start right? Because, the old song, how are you going to keep them down on the farm after they've seen gay Paris? The same thing applies to, ultra processed foods. Kids are indoctrinated early that these are the value foods.
Yeah. Yeah. I mean, it drives me crazy how a kid will go to like a 30-minute soccer game and then be rewarded with, donuts afterwards, as if they they need to
Gotta
refuel
fuel up,
after.
right?
Right.
Or really sugary energy drink, something like
Yeah,
that.
exactly, exactly. It's part of our culture. And, part of it also starts with school meals and, what has been allowed under the prior dietary guidelines to have these sugary muffins and chocolate milk and cereal as sort of school breakfast, and the lunches being, just pizza and carbs and carbs. It's not been a healthy way to teach our kids how to eat. And what used to just be adult diseases, type 2 diabetes, prediabetes, fatty liver, are now becoming childhood diseases, adolescent diseases. So we clearly have gone the wrong way. So yes, it's a big push for Coalition for Metabolic Health to address this by improving school lunches, by having school meals reflect the dietary guidelines, by teaching parents and kids alike what is healthier to eat. And, we live in a world where trying to avoid all processed foods is likely not going to happen overnight, but certainly by reducing it, focusing on whole foods is going to be a very effective first step. And there's the reality of it, some places it's harder to find. Some households, they're not going to have time to prepare it. And this is where we really need to get policy involved, where we need policy makers involved to make it more affordable, to make it more available to individuals. And it really has to start from a top down, to make it available, and from a bottom up, from an education standpoint. So for the coalition, we're hoping to affect both sides of that equation.
Do you have the ear of the administration on some of these subjects? At least you're aligned for a change, because you were kind of shouting in the wilderness before, when previous administrations have adopted kind of a quasi high carb diet.
Yeah, no, you're absolutely right. At least there is much more of an alignment. And I've been fortunate enough, as have other members of the coalition, to go to the Hill and to meet with senators and congressmen and congresswomen, and to actually meet with, the HHS and the NIH, and to have these discussions. So the fact that they are open to hearing it and discussing it and considering it is a wonderful, wonderful first step. Now, hopefully we will see that through it to the point of even more and more and more action taking place to make this a reality.
So this is a coalition. This is a coalition of health professionals, but also it's open to lay people. So people who are listening to this, they can sign on to the coalition. They can sign a petition, or they can get aligned with your initiatives.
Yeah, I mean, they can certainly come to the website and sign up for the newsletter and be kept abreast of everything we're doing. And then, we keep adding members who sort of fit our criteria and who are going to be instrumental in making this movement kind of move forward. So, yeah,
so you're open to health professionals of various professional status to join up with you.
Absolutely.
Doctors,
Yeah.
nurses, nutritionally oriented chiropractors, naturopathic physicians, all down the line in terms of health practitioners.
Yeah, now, interesting. I feel like we've accomplished a lot as a coalition, but we are still pretty new, and we are, still working out a lot of our growth strategy, our growing pains, as you say it, and how are we going to, cast the tent wider and involve everybody who wants to be involved, because we certainly want, to have as loud of a voice as we can. So there's definitely going to be some changes coming along as we grow. But for now, we just want everybody to know about us, to check out our website, to sign up for the newsletter, and to lend your voice to making metabolic health mainstream in medicine.
Indeed. Well, that's a great mission, and I'm going to look into it, because certainly my views are aligned with yours, should you accept my offer of membership. And, I'd like to become part of this. Perhaps some of our listeners will as well. So great stuff. So coalitionformetabolichealth.org, Dr. Bret Scher, thanks for taking a lead in this very, very important initiative. I think that the coalition is going to make a big difference for the health of Americans. Appreciate it.
Well, thank you. Thank you very much. I appreciate the time.
My pleasure. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health. You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant, and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.